scanning to make sure to go behind you.
I am scanning the room.
Sorry. It's gonna be awkward. Okay, so the first thing I would do, I guess I'm gonna do the NG too. The first thing I would do, review the patient's medical chart for any diagnosis or allergies that could mess with my procedure. Next thing I would do is gather my materials. After I do that, I would knock on the door, provide privacy by shutting the door, and introduce myself. Like, hello, Henry. My name's Brittany. I'm going to be your nurse today. We're going to do your nasogastric tube. Can you tell me what your name and date of birth is? Thank you. Can you go ahead and check your wristband? But before I do that, I would do hand hygiene. Like, let me wash my hands real quick before I touch you. Okay, great. All right, perfect. Thank you. And then I would explain the procedure to him. Okay, Henry, this is what we're going to do. Just really quick, we're just going to go through your nose. We're going to put a tube through your nose, through the back of your throat, and down into your tummy, okay? Shouldn't be too hard. But I need to know, do you have any kind of facial trauma or a gastric sleeve or bypass? No? Great. Okay. So first thing I want you to do is cough into this tissue. I first put on gloves because I don't want his gunk all over me. Not sure which Henry, we'll get there. Okay, so cough in this for me. Perfect. Now next thing we're going to do is we're going to check your gag reflex, okay? Take my pen light. Gagged? Great job. Okay, next thing that I would do is remove my gloves, wash my hands, probably put gloves back on, and then position him in a, raise the bed and position him in a high Fowler's position. So if he was comatose, I would put him in a semi-Fowler's position. And then if he had to lay in a supine position, I would put him in a reverse Trendelenburg's position, which basically looks like this. This is his head, these are his feet. Okay, now that I have him in this position, I would go ahead and get my supplies ready. Okay. Let me get my gloves off real quick. Sorry, it's going to be a long video. Okay, so I'm going to get some tape here ready. While I do that, go ahead and get his lube out. Go ahead and stick that in there, get that ready. Okay, I'm going to do one for temporary, one for the anchor, put in the lid pins, one for marking, and one for his gown. Okay, Henry, just a quick reminder, this is what we're gonna do, okay? I'm gonna explain the procedure to him again. I'm gonna put this through your nose. It's gonna go back to your throat, okay? It's gonna be uncomfortable, but it's gonna be painless. We're gonna do this as quickly as possible. What I need you to do is to listen to my instructions. Put your head down when I tell you to put your head down, and swallow when I tell you to swallow, okay? Great. Okay. Why do I feel like this looks weird? Okay. And so, I would have him go ahead. Oh, before I did that, I would check the patency of his nose. Almost forgot that. Okay, so what I want you to do is close this, take a deep breath in, take a deep breath out, close the other nose, take a deep breath in, deep breath out. This is the most patent nostril. And so I would then insert it. Once that goes in, okay, I need you to put your head down. Okay, keep going. Swallow, swallow while this is being inserted. I am going to, while he's holding this, I'm going to be listening for any coughing, voice changes, or air. Oh my goodness. Hold on. Oh my goodness. Okay. So once I get that done, I'm going to, before I temporarily mark it, I'm going to temporarily anchor it. I'm going to check the placement by checking the back of his throat. It's there, good job. Okay, checking the back of his throat. And then getting 30 liters of air. I think I can remove this, can I? Yeah. Okay, put my stethoscope on. Auscultate his stomach. I heard gurgling. And so we're going to aspirate a little bit of that. Get my stuff out, clamp that. Good job. Put this back. Check the pH level, which should be 1.5 to 3.5, and an orange color. So we did all that to verify if this is correct placement. So we're going to go ahead, put that there. I'm going to mark my placement. And then I'm going to permanently anchor it. And I'm going to perform hand hygiene. Go ask the doctor for an x-ray. I'm also going to measure in metrics from the tip of the entry point to here. then going to mark this to his gown. Provide him the necessary equipment for oral hygiene. Get a wipe. Clean off his face. All the lube and the gunk and stuff. Would have put him in a comfortable position before we went into the x-ray, but we went ahead and verified that. And then I am going to put him, lower the bed, put him in a comfortable position. Lower the bed a little bit. Raise the side rail. Henry, here's your call light. Is there anything else I can do for you? No, there's not? Okay. I would then gather up my equipment and dispose of it. Wash my hands. Go document the date, the time, the size of the tube, the type of the tube, the patient's tolerance of it, the patient teaching, the verification of the tube size, the auscultation and the x-ray, and then there's one and I'm forgetting. Ashton told me what it was last time, and I can't remember. But yeah, I'll document that. Woo! Done.